Hello, good afternoon, everyone. Thank you for getting back in here for our session while you're digesting that amazing lunch. My name's Katherine Catalano. I lead the Center for Climate, Health, and Equity at the American Public Health Association. And I'm so happy that you all are joining us today for this conversation about building mental and emotional resilience to the climate crisis. I loved earlier, somewhere in the middle of the misinformation session, Dr. White asked, who's angry? If everyone can raise your hand, if you're angry about the climate crisis. Yeah, here we are all in this together. I'm going to hit some other segments of the climate emotions wheel from the Climate Mental Health Network. Raise your hand if you're also feeling fearful about the climate crisis. Yes. What about overwhelmed? As doctors and activists in here, hopefully seeing all the raised hands, we're not feeling particularly lonely today. That's another climate emotion. Often we can feel as if there's too much climate apathy out there outside of this room, and a lot of folks feel lonely in their negative climate feelings. But APHA did some research with Eco America, the American Climate Perspectives Survey, actually said more than half of people in the US have experienced negative climate emotions. And closer to actually 60% are at least curious. Now, it is our job, obviously, call to action, to get out there and convert that curiosity into fear. That is essentially, right? It's oversimplifying it a little bit, but people know about climate change as a theory. Most people these days, we talk about it enough. But we go out there, we tell them about all the ways climate change will impact their health, and that is going to evoke some fear, right? Fear about the future, fear about our health, that of our communities, that of our families. And then if we continue mobilizing people, hopefully we convert that fear into anger when we tell them who's responsible, right? And what happened. We all have negative climate emotions, and those aren't a bad thing, right? We need those to power action. You know, sort of hear a completely agnostic scientific fact and say, that's interesting. I'm going to spend a large chunk of my limited free time on that issue now, right? We have to sort of have that fear, that anger. But what we're talking about today isn't just the negative climate emotions that we all share in this room. It's when those feelings can become overwhelming, when we experience climate traumas that can lead to adverse mental health impacts. Impacted communities and individuals can experience trauma from being displaced from their homes, suffering from personal injury, illness, or loss, and having their community networks, natural surroundings, and infrastructure disrupted. Young people in Indigenous communities can especially feel a loss of connection to the natural world and overwhelming anxiety about their future. And health professionals and climate activists working to address the crisis experience additional strains that come with facing the terrible impacts of the climate crisis day after day after day, as I'm sure we're all feeling, particularly in this moment right now. Climate change delivers a host of population-level traumas, which are experienced by whole communities together. These direct climate impacts can be compounded by other population-level traumas, such as rising violence, housing and food insecurity, racial discrimination, and infectious disease outbreaks. Our mental health, human services, and disaster mental health systems cannot assist all the people in need today, and this gap will only grow over time. Today, more than 120 million people in the US live in federally designated mental health professional shortage areas, and many in need will not seek care for reasons such as social stigma around mental health care and lack of resources. A public health approach is needed to address the impacts of climate change on mental health at the community level, at the population level. We need to care for each other, working towards climate health solutions while building each other up. Today, you'll hear from our expert panel on just that, building individual and collective mental and emotional resilience in the face of the climate crisis. I can't read my own handwriting. Mm-hmm. Yes, the need to not only deal with climate traumas after the fact, but also prepare our communities to survive, to shoulder. This is starting out great. Prepare our communities to shoulder the inevitable future climate traumas that we'll all be experiencing together. So without further ado, I'm going to introduce you to your panelists one by one and have them each share their opening statements with you. So we're going to start with Dr. Lise Van Susteren, who's a general and forensic psychiatrist in Washington, D.C., and an expert on the physical and psychological impacts of climate change. In 2011, she co-authored The Psychological Effects of Global Warming on the U.S., Why the U.S. Mental Health System is Not Prepared. Dr. Van Susteren is a clinical associate professor of psychiatry and behavioral sciences at George Washington University. Welcome, Dr. Van Susteren.
Thank you, Kathy. Trust you all had a good lunch. I was asked to do an overview of the psychological toll of climate instability. And I would like to ask you not to slay the messenger when I finish my statement. When I asked a widely respected colleague to join the climate battle a few years back, she said, "What does climate have to do with psychiatry?" It's a question I am often stunned to be asked. I always answer it pretty much the same way. If the place you call home is burned down, blown away, dried up, flooded, when you lose your possessions, maybe your pets, your livelihood, your community, see injuries, illness, and death, common sense and life experience tells us how we would feel. The mix of fear, anger, sorrow, and trauma can easily drive us to a breaking point. We here have a critical role. Our work here is to stir empathy, to break through the intellectualizing and other defenses, so we make the emotional connections that drive us and others to take sustained action. There are the climate traumas that are current and those that are coming, bringing what I call climate-linked pre-traumatic stress. Neuroscientists have deepened our understanding of anxiety. Just because we aren't conscious of our worries doesn't mean the worries aren't there and registering. Our bodies keep the score. So, conscious of them or not, threats can be perceived by the amygdala and alarms raised. Stress hormones are released, affecting our physical health and exacting a psychological toll. Collective, widespread distress can shape our culture, affect the national mood, and they're a factor in the vitality of our economy. They polarize us politically. It colors how we treat each other in our families, communities, our country, and particularly those we see as different from us. Much of the discord and violence in the world is attributable to feelings of powerlessness and vulnerability. Climate instability provokes a profound sense of both. Threats to democracy. As a former CIA profiler of world leaders, I fear for our form of government. I wrote those words more than 10 years ago. In times of peril and scarcity, we see a rise in authoritarian government because people turn to what they perceive as strong leaders to protect them. They may be willing to give up long-cherished values in exchange for the promise of perceived security. Heaven help us from the tyrants, the bullies, I used to say could be unleashed, but now I have to say have been unleashed. The cumulative toll of both direct and indirect impacts of acute and chronic conditions, and the domino effect of failing ecosystems, sea level rise, dramatic declines in wildlife, resource scarcity, economic hardship, and the associated societal instability and geopolitical consequences is playing out alongside declining government commitments, indeed alongside rising threats, and in the face of accelerating climate consequences, clearly driving profound and widespread anxiety. It would be dismissive for me to bottom line this with have hope. Choose to be optimistic, as a neighbor of mine with a high carbon lifestyle airily said to me recently. His wife once told me, as I was joining their Christmas party, and don't bring up climate. Well, we need to be realistic. Our planet is rapidly approaching tipping points, but we can take heart. More and more people every day are taking action. And embedded in our fear, anger, and sorrow are deep pockets of energy to be harnessed and redirected into constructive action. Turning now what we know into what we do. We don't know why, but we are the ones who are here. It is up to us. Raise your hand if the late great hero, Congressman John Lewis, means something to you. Yeah, right? Clubbed on the Edmund Pettus Bridge as he fought for voting rights on the March to Selma, he charged us not so long ago with unforgettable words. If you see something, he said, that is not right, that is not fair, that is not just, do something, say something, make trouble, good trouble, necessary trouble. And in the end, enough solar energy reaches Earth every hour to meet all the Earth's energy needs for a year. Wind provides 40 times what we need. We can change the world, but we have to be smart, we have to be together, and we have to hurry. Thank you.
Thank you, Dr. Van Susteren. Okay, next up, we have, and I notice I think our slides are out of order here. That's okay. Next, we have Jessie Kohler, who is the Executive Director on loan at the Campaign for Trauma-Informed Policy and Practice. Jessie is on loan from the Change Campaign, which he founded, and it's a nonprofit organization with a multi-pronged initiative to build community and systemic capacity by facilitating the application of the science of development adversity and its progression through the lifespan and generations to enable initiatives that improve holistic well-being and provide strategic support to government agencies and organizations focused in aligned areas. Thank you for being here, Jessie. Here we go.
After Lisa's wonderful presentation, you just got her slides very, very quickly. So I was inspired this morning to kind of change the orientation of the presentation, and we'll start by sharing that I began in my activism and advocacy journey when I was 12 years old. We heard from an 18-year-old who makes me feel very old this morning about her start when she was 12. But I was 12 years old when an inconvenient truth came out and learned that I think at that time in the film, 50 years from now, there was going to be, we were going to hit a tipping point, and that devastated me. It wasn't until a year later, actually, that the biggest anxieties from watching that film started to rain down on me, which we often see after huge magnanimous events like that. It's usually within 6 to 18 months following the disaster or event that we see the largest psychosocial effects. And for a year, I struggled tremendously. I mean, I still struggle to some extent with it, but for a year, I struggled beyond a reasonable level with anxiety. And then I was able to turn, with the help of teachers and coaches and my family and community, that anxiety into advocacy. And so often we talk about how democracy is an antidote to trauma, how getting involved within shaping systems, one, help us make sense of our experiences, which one of the hallmarks of trauma is fragmentation. A fragmented narrative can come out of that, and making sense out of our experiences, shaping that to make a positive change in the world around us, can help us build agency and actually lead part of a healing process. It can be a core part of what promotes healing. It also requires regulation skills and processing and listening to different perspectives. And so when we talk about getting involved in various levels, there's actually a trauma-informed element to that. And while my anxiety or my advocacy began with climate and wanting to create clean energy, through my professional world or life and career so far, I have been more along the lines, as you can see from my title, that I am in the trauma-informed world. And now I think that we are starting to see more and more that the overlap between that Venn diagram is growing more and more, as Lisa pointed out, better than I will be able to. There is such a strong and real nature to how our, I just totally lost my train of thought thinking about everything that you just said, Lisa. But we can make positive change. I'll just go there. Oh yeah, we can, if we are dysregulated, which I just was for a solid second there and regulated myself again. But as there are more and more stresses that we face, if we are not in this together, and we will talk more and more about building capacity within communities to help us get through this together, it makes it more and more difficult to develop the long-term strategies and the complex changes that need to be made from an individual level to a societal level that will help curb the climate crisis. And so trauma-informed approaches are a necessary component to this. We heard, I don't know if I just turned off that screen. I apologize if I did. But we heard earlier about Schoolhouse Rock, and there is a bill that actually brings together in Congress right now the overlap between those two Venn diagrams called the Community Mental Wellness and Resilience Act. I don't know if that is something that, I know that there is a whole slate of advocacy that you all will be moving on Tuesday, but the Community Mental Wellness and Resilience Act is a grant program that helps build population level resilience to the impacts of climate related disasters and other disasters. When we talk about this bill, we can talk about the impacts of extreme weather events and other disasters. When we're advocating for this bill, we don't necessarily need to agree on why or how climate emergencies or extreme weather events are becoming more severe and more frequent. There is an overriding knowledge and understanding within Republican and Democratic offices that we have more and more extreme weather events that we need to build capacity toward, and promoting cross-sector community coalitions is going to be a key part of what we do. And so in addition to the policy work, because with the work for the Campaign for Trauma-Informed Policy and Practice, we want to bring policy and practice together where good practices are informing the ways that policy gets unleashed, and then having policy then enable good practices down at a community level. We are also promoting what we call transformational resilience coordinating networks, where there is an opportunity to leverage the stresses and adversities that we face to build and catalyze growth and development toward a more resilient and different sort of environment. And that's what the term transformational resilience means. And so in our work with communities, we work to build 5 foundational protective factors that a researcher named Bob Doppelt has found through global studies helps to build community capacity that helps build that population level resilience. So we're talking about building social connections, ensuring a just transition as we move forward, building universal literacy about, I'll use the term transformational resilience, but that can be mental well-being. There's a lot in a jargony term right there. Foster engagement in practices that enhance well-being and establish ongoing opportunities for residents to heal. And what you'll see in the press-on framework that our TRCN and CMWRA work is that across the social ecological model, we know that healing happens in the context of healthy relationships over time. The most important side of this work that is going to promote healing is not going to be in the halls of Congress. It is going to be in the grassroots where people have relationships every day. But like we've been talking about all day, there are opportunities at policy levels and systems levels and community levels to build the capacity to promote that healing and enable those relationships to be made that create a bidirectional flow where the work at a local level, as we coordinate and organize and network across each of these levels, creates opportunities for us to learn what is working and is not working so that we are not constantly reinventing the wheel. Have policies that then learn from that and systematically synthesize that information and provide resources that enable that work to occur at state, local, and community levels that create that bidirectional flow that will propel the movement forward using community-led work. And I think I'm over time, but the last thing that I will say in terms of systems transformation is that in addition to the policy work, in addition to the community work, we heard about financing options earlier, and we are working to also build out of the Change Campaign work to create a project finance approach to invest in cost avoidance so that we can fund this work long-term rather than just year to year or short-term, but really enable those generational shifts through a systems transformation level that take place across each of these levels. And so, like I said earlier, I have the privilege and pleasure to get to work at the policy level. The background of my career comes from community organizing work in the city of Philadelphia. And we have someone who you can see at the top right of that far screen, Ruben Cantu, who is going to get to tell us a lot more about the important community type of work that is taking place in this area. Thank you.
Thank you, Jesse, and thank you for pre-introducing. Our last speaker is here with us virtually, right there up on the screen. So I'm proud to introduce Ruben Cantu, who is the director at Prevention Institute. He has nearly 30 years of nonprofit experience in public health, safety, and well-being, with a focus on equity and racial justice. At Prevention Institute, he leads initiatives to address and prevent community trauma through application of PI's Adverse Community Experiences and Resilience Framework. He also works on strategies to improve mental health and community safety through a focus on community conditions. This includes managing the Sync Safety, a CDC-funded learning community, engaging with 30 Black and Brown-led community-based organizations, applying a public health approach to community safety and preventing violence. Thank you so much for being here, Ruben.
Thank you, and just making sure that my sound sounds okay.
Yes.
Okay. I'm going to keep on going. I really wish I could be there with you all today. I know from talking to friends and colleagues in the DC area that the mood is often a little grim these days, and definitely sounds like it's a very different place from what it was when I first moved to DC 30 years ago. And I wish I was there with you all because I know that community and connection and collective action are some of the best antidotes we have to some of the collective trauma that we are all facing at this point in our lives. My name is Ruben Cantu, and I'm with Prevention Institute. We're a national nonprofit organization based in Oakland, California. And I'm coming to you all from the Bay Area this morning here, this afternoon for you all. We are, if we can move to the next slide really quickly. We are a national organization that's focused on the practice of primary prevention, addressing and preventing challenges from occurring in the first place. A lot of that has to do with making sure that the work we're doing is focused on a community or population level. A lot of it is focused on making sure that we're moving upstream and that we're looking at policy and practice that we can put into place so that we can prevent a lot of challenges we're facing from happening in the first place. Next slide. Through a lot of the work that we've done over the years around things like violence prevention, mental health and well-being, and substance misuse, we've come to the understanding that trauma manifests at a community level as well as an individual level. And that this manifestation of trauma at a community level, it's not just about the aggregate of people in a neighborhood who have experienced trauma, but it's about the impact of chronic adversity across an entire community. And a lot of times I mentioned that this is, you know a neighborhood, a community that is facing levels of community or population trauma when you walk into that neighborhood, and you can feel the aura, you can feel the vibes shift a little bit in that neighborhood. It might be because that neighborhood is lacking investment. It has boarded up stores. It has parks and sidewalks that are kept in disrepair. And these communities that are feeling this level of community level trauma, in addition to a lot of the individual level trauma that they're facing, really is a huge barrier to coming up with the solutions that we need to promote health, safety, and well-being. Next slide. And one of the things that leads to this level of community trauma are structural drivers, which are the inequitable distribution of power, money, and resources. And these structural drivers create the conditions that harm communities and become the structural violence that we see that's harming those communities and contributes to that trauma. And an example here is you've got the housing market, but because of the way that power, money, and resources are inequitably distributed, and how some folks have more power or more control over the way something like the housing market or the market economy works, we end up with community conditions like displacement and gentrification and homelessness and unsafe housing. Next slide. And that manifests in these symptoms of community trauma across a community. Things like damaged social networks, a low sense of social and political efficacy, deteriorated built environments, like I mentioned, intergenerational poverty. And these conditions make a community more vulnerable to other harms, including things like the climate crisis. It kind of wears away at a community in a way that makes them more vulnerable to things like what we're seeing with climate, what we're seeing with substance use, what we're seeing with violence in our communities. And I think we all know that a lot of those things are interconnected. If you see an increase in one of those, you're going to see an increase in another one of in others as well. And the way that we need to, next slide, the way that we need to really look at and challenge and address those kinds of community level challenges and that kind of community level trauma is with strategies that build community level resilience as well. And healing is such an important part of that. We kind of see it as the center of the strategies that we need to put in place to address those kinds of harms that are facing our communities. And then we can also work on strategies that address the way people connect with each other, the way that places harm communities as well. Some of the things I mentioned, like homelessness and unsafe housing and a deteriorated built environment. And then also look at equitable opportunity and come up with strategies that address opportunity available to folks through wealth building opportunities, education, and things like that. And it's by looking at the ways that we can collectively, as community members, build our resilience in those areas that we can start addressing some of the larger systemic, some of the larger systems that are the things that are harming our communities. Things like the economy, our justice system, housing, immigration, because all of those things make our communities more vulnerable to the harms that we're seeing. I'm going to skip the next slide and go to this slide right here and talk about a group that we've worked with to kind of wrap up my 5 minutes. I think I've gone over. But we've worked with a group in Honolulu, a project out of the Kekuakahili Valley Comprehensive Health Center. And it's a bike exchange that these young men were a part of. And these are young men that live in kind of one of the poor areas of Honolulu. They face a lot of economic inequity. They're feeling the effects of the climate crisis. They live in an area where the built environment isn't kind of kept up for them. And one of the things that they would do is they would get together wherever they could and work on their bikes. And this health center said, they saw this happening. They saw this happening like in their parking lot. And one of the things that they decided is, we've got space. We're gonna we're gonna clean up one of these spaces that we have and invite these young men to come in so that they can work together on their bikes in our space so that they're not having to do it outside. And once they did that, they realized that these young men that were a part of this project, they had the motivation and the energy to want to make change happen in their communities beyond just getting together and working on their bikes. And so they started implementing leadership development programs for these young men and were able to harness their collective energy and enthusiasm to be able to turn them into advocates who would go to their city council meetings, who would go to their county board of supervisors meetings and advocate for the changes that they needed to see happen in their community, whether it was about improving bike lanes or increasing funding for mental health services or for coming up with strategies to address the climate crisis. And these young men grew from these kind of like preteen and teens to these college-age students over the years who now lead the program, lead some of the younger men into becoming the kind of leaders that they became. And so I just wanted to highlight that example as a way that, with that community, with that connection, with that collective action, we're able to really move to a place where we can have some solid change happen in our communities. And so next slide just has my contact information. I'll leave it right there and pass it back over so we can have our discussion. Thank you.
Thank you, Ruben. Thank you. We're going to transition to our conversation really quick. I do want to say I'm so grateful that we were able to end on that concrete story of a program happening in community. Because, in opening, I was talking about sort of the inevitable fear and anger and all of these negative feelings that come with talking about the climate crisis day in and day out. But it really is that element of real solutions, bringing people hope. All of your climate communication, all of our climate work really does have to incorporate that solution-oriented framing. And it's so wonderful to see real programs and real communities. And that sort of sets up for my first question for you all. Oftentimes people say, action is a great antidote. We have to be working together in community. And a lot of people in this room and online are doing that every day, are engaging their communities in climate actions. What are some concrete steps they can take to more intentionally do that from a trauma-informed approach? How can they create their programs and initiatives with an eye for building community connections and building emotional and mental resilience and well-being?
Happy to take a first step. So we talk about trauma-informed advocacy a lot because we know that as advocates, we wind up wearing a lot of the stress and adversity, and that leads to the burnout that so many of us struggle with, face, and leads to a lot of the reduction in the advocacy movement as a whole, right? And so we want to think about how we embed trauma-informed principles into our advocacy itself, supporting others, supporting ourselves, and that's a process. One of the things I say often, which might not be great for the business of the Campaign for Trauma-Informed Policy and Practice, but I don't think that there is a real thing as being trauma-informed. Right, I think that being trauma-informed is part of an ongoing process of learning and growth because we will never be perfect at reducing all trauma and knowing what everybody has been through, right? And so we're just constantly learning and growing. But the 6 principles from SAMHSA's framework, which are trust and transparency, collaboration, safety, peer support, voice, choice, and empowerment. And then sometimes people say that those are the 5 principles. Other people say that there's a 6th principle. Others say that it's woven throughout those 5 principles, but a recognition of culture, gender, and historical issues that come up as we are trying to operationalize and support other people getting involved is really important. And then in that, listening to diverse perspectives, it's that process of how we think about integrating all of those different pieces into the advocacy, into building coalitions that move and propel the movements that we are working behind forward, that I think create trauma-informed environments, conditions of empowerment and safety that keep people going, able to come back to a group if there's a meeting that goes poorly, and reflect and process that, or celebrate if a meeting goes well. And all of that's really, really important in building movements.
I'm going to take it from a slightly different perspective, and that is, I'm sure many of you remember the name Willie Sutton. He was asked why he robbed banks, and he said, because that's where the money is. So what I want to point out to us is that we are all converted. We're all working, we're doing this stuff, and we do tend to talk to each other, meet and exchange ideas, etc. But there's a whole big world out there of people who don't know what to do and are confused. They may want to do something, but they're busy with their lives. They don't know what to do. So one of the efforts that the Climate Psychiatry, Climate Psychology Alliance has done is we've formed a joint committee called the Outreach and Advocacy Group. And it is filled with people mostly who are related to the mental health profession, but not necessarily, school psychologists, et cetera. And what we have done is we are organizing by state. And I'm going to tell you in a minute what the point of this is. And that is that we have posses now in various states. Our most active, of course, is DC, Maryland, New York. We have a breakfast coming up on March 25 with legislators, followed by a press conference. So here's the point, is that much of our work relates to how we talk within our silos. We need to go out and talk to the people that we don't ordinarily see and we may not be comfortable with. Certainly it is not our habitat to be going to the political arena with the legislators. We've seen that the federal government is not going to be helpful to us in the next couple of years. It is imperative that we go where we can be successful and that we get out, and please look at joining outreach and advocacy, meeting with legislators. And this is what's critical. People don't know how to do stuff. And we have something that starts off with step number 1, find your phone. Step number 2, if you're not at your computer, go to your computer. Step number 3, type in your state and then legislative committees. Mark off the ones that you think are relevant and then call and say, I want to talk to the chief of staff. And what we are doing essentially is turning what we know into what we do. We are going to those staff members, we're asking for the sun, the moon, and the stars. And in particular, for example, in New York, we are asking, and this is critical, talking to legislators, is that we have an ask. Our first ask is we want a hearing. And we want to bring young people in to talk about what they are going through. This is the empathy factor. Everybody's got kids. When a kid talks, you can hear a pin drop. We are looking for a task force within each state to assess the strengths and the weaknesses, all about the resilience building possibilities, who are the vulnerable populations. This is preventive and it can be after a trauma. And third of all, and I think that Ed Maybach must be here somewhere. I see, Robin Cooper and Steve Peterson are also members of Outreach and Advocacy. Raise your hands. We are calling for a cabinet-level climate solutions office so that people can talk on a level that shows that they have power and that it integrates with existing policies. And there's plenty more. But here was that point that I was trying to make, is that much of the change that we see in us as a society is not because someone read us the Riot Act or had a little statement here or there. It's because we saw other people doing it. This is the power of social norms. It's why we're not sitting here smoking cigarettes and blowing it into each other's faces. It's why we buckle up. It's why we practice safe sex. And I think that we forget When we have and reach out to people who typically are voting against the issues that we know are going to keep us safe, we need to be with them. We need to change their minds. When people see what we are doing, they unconsciously pick up on it. That means our legislators, people in the task force, people who hear about the task force, and as change occurs, those social norms, you get 10% of the population doing something, the rest follow. So think about the things that you can do that are different from what you typically do. Reach out to where the money is, the people making policy, and the people who vote for the people making policy.
Thank you. And Ruben, since we're almost out of time, I'm going to turn to you with that question, but combine it with a good one from the audience for you, Ruben. Are there examples of how trauma-informed climate change work and mental health and climate change in general that more authentically center low-income and BIPOC communities, knowing mental health is stigmatized and healing looks different in some communities?
Yeah, that's a great question. Using the same example of these young men that were doing this work in Honolulu, the work there was very specifically focused on making sure that young men and boys of color were focused on doing this work. And the work wouldn't have happened if it wasn't something that they had already prioritized and that they knew was a challenge for them. The younger generations of folks that are coming up right now, I feel like they're so much more connected to what's going on in the world than I was when I was growing up in the 70s and 80s. They know what's going on. They're connected for good or ill through social media and hearing things all the time. And so they know what all of the challenges were. And so when they went into this project and agreed to be part of this like leadership development work that they were doing, they came into it recognizing that there was just such a complex interplay of challenges that they were facing and that they wanted to address. Things like access to mental health care services, the intergenerational poverty that they saw in their communities, the lack of well-paying jobs, the lack of things as hyper local as like the fact that they didn't have bike lanes to kind of like ride in when they had their bikes all fixed, the climate crisis. And so they wanted to come up with strategies that could try to address all of those together. And the more and more they did this work together, even though they had each other to rely on, they also were burning out really, really quickly. They would be part of the program for like 1 or 2 years, and then they would start seeing some of the young men that were part of the strategy making and the leadership development just drop out. And when they would follow up with them to kind of see like, why is it that you stopped coming to these meetings or engaging in some of the advocacy activities, they basically would say like, we're burnt out. This is a lot. There's a lot of stuff going on. It's a little overwhelming, and we don't know what it is. We don't know what we can do and where we can go from here. Luckily, this program was being hosted and sponsored by a community clinic, an FQHC, a federally qualified health center. So they were able to like tap into folks that had experience, who were licensed clinicians who could help these young men. But then they also realized, as part of these programs that we're doing, we need to make sure that we're incorporating some of these strategies to reduce stress, to address some of these concerns so that we don't burn these kids out at the age of 16 and have them not want to engage in these strategies again. And so they were pretty successful in, re-engaging with some of these folks through incorporating some of these, what we would call trauma-informed strategies to kind of re-engage folks, make sure that they were engaging in a way that is that is like respectful of where they were coming from as low income people of color, but also the overwhelming kind of sense of adversity that they were seeing in their communities.
Thank you, Ruben. And I wish we could chat more, but I know it's time to end here with us. But thank you all so much for a wonderful discussion. And just for everyone in the room, we have some resource slides for you real quick. So if you have your phones out for some QR codes. Dr. Van Susteren's book, Emotional Inflammation, talks about all of this and more from a broader social justice lens. You can also find as she mentioned, the Eco-Psychopedia and Climate and Your Mind at these links right here. So I'll give you just a couple more seconds on that one because I have more for you. So keep your phones out. We're going to end with this one. And then I see a couple people still trying to get it. We also have here, as Ruben was talking about, Prevention Institute's Adverse Community Experiences and Resilience Framework for addressing and preventing community trauma. And then also there's a Q&A that goes into more detail on the framework. Definitely worth a read. And then this is a new APHA resource that we are releasing right now here today with you all. A public health approach to building mental wellness and resilience in the face of the climate crisis, recommendations for community groups. This one is really like a helpful intro guide if you are doing climate work and want to incorporate some of these principles we've been talking about today. This is a great place to start and learn more and find more resources. And oh, we're missing one. Well, I'm sorry, Jesse. We also had the link. I didn't see it anywhere else.
You go to ctipp.org.
Yeah.
Our TRCN work and the CMWRA work are under the Press On tab. Sorry that we don't have a QR code.
Apologies. Yeah, sorry. That's okay. Yes, go to ctipp.org, CTIPP, 2 Ps. For more information on actually getting, someone asked if there was a training. They have some videos from their wonderful community of practice on this work, as well as an opportunity to sign up to more formally engage in building transformational resilience in your community. So thank you all so much.